Hey everybody, it's Kevin Henry. I'm the editor-in-chief for DrBicuspid.com and the founder of Dental Assistant Nation. So glad you joined us for a part of the series that we are doing with Solmedics and Stericyl regarding dental unit water lines, safety, biofilm, all the stuff that you need to know to keep your practice and your patients safe. And that's why I'm so thrilled today to be joined by Michelle Strange, RDH, and let's talk some biofilm. What do you say?
I love it.
I know you've done a lot of research, a lot of lectures on this. Let's just talk about basic 101.
Yeah.
Biofilm and dental unit water lines. What's the problem here?
Well, I think we are all very well aware of biofilm. It literally is what keeps us busy, right?
Yeah.
And like, it's what keeps us in business. This is biofilm. And so like, as a dental hygienist, I'm kind of reminding people, like, it's not just happening in the mouth, it's happening in our water lines.
Yeah.
And we also know now, like, we've evolved with our understanding of disease, that it's not bacteria specifically, it's biofilm. It's the pathogens in that biofilm that creates the disease that afflicts our patients. And it's what's happening in our water lines. And it's going to create potential risk for people if we don't manage the biofilm in our water lines too.
Is it a factor that we don't see it, so we don't think about it? Do you hear about that a lot?
So I probably started my waterline journey in 2019.
Okay.
So it's been, I'm on my 20th year as a hygienist, 25 in dentistry. 2019 is when I started this. And I did not realize how dirty my water lines were. Because honestly, you're spraying it into somebody's mouth, you don't actually see the water.
Yeah.
If you actually sprayed it into a cup and you have not been treating or maintaining, shocking, testing, it's probably going to look pretty icky. But we don't see it.
Right.
We don't see it. And that's a problem.
So what was your reaction that very first time?
So I feel like I got a little bit of a name in waterline space because I started testing the toilet water of the offices I was in.
Okay.
And comparing it to the test of the water lines.
Oh my gosh.
And I passed every single time for the toilet water and not the water lines.
Oh, wow.
And the reason I started doing that was because I was in this practice. It was actually 2019, like I said. We were closed down just a little bit for, I don't know, somebody was on, doctor's out of town, whatever.
Sure.
And me and the assistant were going to start doing this waterline testing thing. And we're failing all of them. And it took me forever to get them passing.
Yeah.
Which we can talk about testing and all the things.
Of course.
But we were working so hard to clean up these water lines. And I looked at the assistant one day and I was like, are we flushing our toilets with cleaner water than we're using on our patients?
Wow.
And I was like, I'm going to go test. And I tested. And that's like what I do in offices now. When they're like, our water lines are fine. I was like, let's test your toilet water. And I'm not talking for the back of the toilet. I'm talking the toilet bowl. And we were passing that before we were passing our water lines.
I mean, I've got to be honest, I'm sitting here and I'm stunned by that.
It's shocking.
And it's scary a little bit too, knowing
yes.
I'm in the chair, you're in the chair eventually. Absolutely.
Yeah. And, it's kind of wild because, like I said, 2019, but we've known that it's a risk since the outbreaks in 2015 and 2016.
Yeah.
So even I, who is kind of mildly in the space and in the know and writing articles and teaching, I was even late to the game, and lessons have been learned.
Well, and like you said, lessons were learned because you did testing eventually.
Yes.
So tell me about testing and what we need to be doing in the dental practice properly.
Yes. So, I say 2019 is when I started testing, but I've been always putting a tablet in my water.
Mm-hmm.
Like, I want to say probably 2007 is when I started doing that. So, like, I've always been doing something for my water lines, but I didn't realize that I needed to make sure that it was working.
Yeah.
But now when I think about it, like your spore testing, like I know I do that weekly to make sure my autoclave is working. I'm trying to make sure that the waterline maintenance that I do daily is actually working. And the only way to know that is if you're testing your water lines.
And I think that there's that shock sometimes whenever we fail. Mm-hmm. How do we rebound in our minds if we fail a test?
So I'm finding if you're doing something usually between a shock and a maintenance, that the fail is maybe human error sometimes.
Okay.
And it could be human error and like you didn't shock all your lines. or you just didn't do the test right. Like I've screwed up Fast Check 15 because I didn't read the instructions for use.
Oh, the IFUs. We'll talk about that.
Daisies. Yeah. I'm my own worst enemy when it comes to IFUs sometimes. So I have messed it up and not gotten a great test and realized it was my own fault. So I actually did not fail. It was just me. The thing I think too about people worry that they're going to fail, they don't test. Okay. Like you hear that all the time, right? Like, I don't want to learn these things because then I have to be responsible for it, right? But if you work with someone like Solmedics and Stericyl, for instance, that has a customer service team behind it, like sure, if you fail, like it's like, oh my gosh, oh my gosh, oh my gosh. But you have people that can handhold you to kind of get you to a pass, which is nice.
And I'm glad you mentioned that there are experts out there because are you seeing that a lot of practices are looking on social media for answers rather than asking people like you, people who are experts in the field?
You know, I don't know if I see it as much on social media. I think honestly, it's just ignorance at this point.
Okay.
Like when I ask people, are you testing? It's more like, what do you mean? Versus like, oh, I saw I didn't have to, you know, like versus like when I ask my patients, are you doing these things? They're like, well, I brush with lemon juice. I'm like, you know, like I'm not hearing it that. I'm hearing more ignorance on the topic than anything.
Okay.
Yeah.
I want to go back to the IFUs for a minute because I think that that's something that we blow past. I get something from IKEA and I think I can put it together without reading the instructions, right?
Yeah.
So how big of a problem is IFU ignorance in today's dental practice?
Well, I will tell you, I am probably humbled weekly by an instruction for use. Like I said, I'm 25 years in dentistry now. I started as an assistant, now a hygienist for 20, and I read an IFU thinking I know what I'm doing, and I am humbled all of the time. So instructions for use are so important. Even when you think you know what you're doing, you need to pull out those IFUs, which I think also standard operating procedures. And if we look at like waterline testing, Georgia has a new rule that just came out. Yep. And part of that new rule around waterlines is standard operating procedures. So the way that I tell people, like, okay, I'm the hygienist, right? But a lot of times this falls on the assistant's, task,
Absolutely.
Right? And so if my assistant that I love so much is out that day, and I know that this is the day that we do waterline testing or shocking or whatever, like I need to do it. Like that's an important step. And so like in this case, I want to create an SOP, a standard operating procedure, where you can insert human. Okay. Right? Like insert hygienist that doesn't do this all the time, right, so that we can make sure that we stay compliant and stay on time with our shocking and testing and everything. So taking your instructions for use and making that SOP is going to be so important in that step. And
making it so, like you said, if the assistant is out, or dare we say in this world we live in, leaves, goes somewhere else, it's so important today.
Yeah. We want to insert human in that case because this is about patient safety at this point, and my safety, quite honestly, and our safety, because it's an aerosol problem too. So
that's a great point.
We really need to be managing these water lines because yes, patients, and we have risk that we've already seen from patients being sick and harmed by our dental unit water. But my upper respiratory tract I find very important as well, and I would like to not be sick.
Yeah, we want to stay safe just as much as we want our patients to. That makes perfect sense.
Yeah.
So I know IFUs were one of 3 things that we really wanted to talk about when it comes to dental unit water lines. What are the other 2 in your mind?
Well, I think just also finding products that are compatible. Okay. I think that's probably the other part to okay, I heard about this thing, but like, where do I start? And then like, can I use it for this particular unit that I have, and like understanding the process of maintenance, testing, and shocking. And I think when you do find products that are compatible, that is going to make your life so much easier. Okay. So for instance, like a Stericyl straw, I can shock with the Citrosil product through it. And like, you might be like, okay, well that seems easy, but like, no, not all of them allow that. And so like, I then need to know that I got to take it off, making sure everybody knows in the office that they need to take it off so that we're not ruining a straw. Things are working together. I mean, it's going to make your standard operating procedure insert human situation so much easier.
And okay, so you mentioned the straw, and you mentioned that it may not work with everything. Is that something that we need to not only follow IFUs, but we work with our manufacturer reps, we talk to our dealer reps about to make sure we're getting the right information in there?
Yeah, and this is where I think it gets confusing, right? So I always say, like, start with your dental unit manufacturer. Do they have recommendations? I'm going to tell you most do not. At this point in time, in the moment, I have not read a lot that have a lot of instructions, maybe a lot of like, don't do this, but not so much like use this in particular.
Okay.
And so what we know is we need to do it. So from there, then finding products that are going to fit within your practice. So for instance, I do in-office, private practice stuff, but I also do mobile. And the products that I use in both situations are going to be very different because I can't use a straw on my mobile equipment.
Sure.
So I would go to a tablet situation. And so like what is going to work best for your practice and how you use it. I also suffer from a little ADHD. So like I also know that in a private practice, a straw is going to be so much easier for me because how often I've been filling my water bottle and being like, oh my gosh, I didn't like write up the x-rays that I took on the patient. And then I'm like filling it up and my brain has already gone to 3 other tasks.
Right.
And I forgot to put the tablet in. So a straw makes so much more sense for me because I might forget. And so if you have team members like me, there's going to be products that are going to work better for your team.
So if you could transport yourself into every little dental practice, a little bit of you everywhere, what would you want them to be doing to really make sure that they're safe?
Yes, testing first and foremost. And the thing that I talk about a lot, and I think is a little bit of a confusing part, is that people will test after they shock. And you're testing your maintenance. That's what you're testing. I always say if you test after you shock, you're going to get all the answers to the test. You know, like you're going to get the A. So we're not testing to see if the shock worked necessarily, unless you failed that test. And then there's a whole process, but that's why you have a team that can help walk you through it because it does get a little confusing. But we're testing to make sure that maintenance is actually working and that our patients, every single time they sit in our chair, are getting clean water that's under 500 colony forming units, hopefully significantly less than 500 colony forming units. So we want to test and the shock. And like I said, I've been doing tablet in the thing since 2007, but it's the testing and it's the shock that also matters. It's a trifecta.
I like the trifecta. Absolutely. Well, we hope everybody's doing the trifecta correctly. So,
I agree.
Michelle, thanks so much for your time today.
You're welcome.
I appreciate it.
Thank you.
And thanks to all of you who've listened to this episode or watched this episode of the Dental Assistant Nation podcast in conjunction with drbicuspid.com. We certainly appreciate experts like Michelle coming on to give their opinions and views on what you can be doing to keep yourself, your patients, and your practice safe. Until next time, it's Kevin Henry, host of the podcast, signing off, and as always, wishing you nothing but success ahead.